Hi everyone, as you come in, just letting you know that we are waiting for the rest of our attendees, so we'll start shortly. Okay, so we've still got a few extra people filtering in, so I'll give it a few more moments and then we'll begin. So welcome everyone who is on here so far. Okay, so far it's looking like the number of people that are entering are starting to slow down. So I feel like I'm relatively safe to start. But if additional people will join, that's also 100% fine. So thank you very much for coming along today and welcome to today's webinar. I'm Alison Beck. I'm a clinical psychologist and I work in research at the University of Wollongong. And thank you very much to Smart Recovery to inviting me along today. So just to begin with, I wish to acknowledge the traditional custodians of the land on which everyone is zooming in from today. I'd like to pay my respect to the elders past, present and emerging and recognise their continuing contribution and connection to the land. And I would also really like to extend my respect to any Aboriginal and Torres Strait Islander peoples who might be zooming in with us today. Okay. So in terms of today's presentation, I'm talking about Smart Track, a new tool that we've developed for Smart Recovery. I want to spend the most of the time being able to give a bit of an orientation and walkthrough of the tool. But to begin with, I think it would be useful to spend a little bit of time talking about the background and also some of the research that led to the development of this tool. I've got the links to the tool there, and I also popped them into the chat feature. So if you haven't already, feel free to download a copy of the app. It'll be super handy when we go through it in a few moments' time. Also worth remembering, more than happy to be able to take questions and hoping to spend a lot of time towards the end of the presentation going through a question and answer section. So if something comes up as I'm talking, feel free to pop it into the question and answer box, and then that way we can group them all together and have a good discussion towards the end. Okay, so just to begin with, some really important acknowledgements. When we were developing Smart Track, we worked in quite close partnership with Smart Recovery. So I would like to say thank you very much to the Smart Recovery participants, the Smart Recovery facilitators. Just checking what's happening here. Okay, gotcha. Sorry, everyone. One moment. Okay. There we go. So links are in the chat feature. Feel free to download and then we can have a play around towards the end. So in terms of my acknowledgements, I was saying that I really like to thank Smart Recovery participants, Smart Recovery facilitators. They played a really big role in being able to help us develop the tool that we have today. And also we received funding from New South Wales Health. So the original development of this tool was funded by a grant from New South Wales Health, as well as that initial evaluation that we did. Also worth mentioning that we got a lot of really useful feedback from the study that we did, and then we were able to action a lot of that and improve the tool based on a really generous benefactor. Also like to acknowledge the wonder that is GHO. They're the development company that worked with us on making Smart Track possible. Their insight, their creativity, their flexibility was just incredible. And we wouldn't have the version of Smart Track that we have today had it not been for them. And also incredibly important to acknowledge that I'm just one of many when it comes to the research team who are involved in developing this tool. So as I mentioned, I want to spend most of today's session actually going through the tool itself, but I thought it would be useful just to provide a little bit of background. So our research team was the first to conduct a systematic review of the evidence for smart recovery. So basically, we sat down, pulled together all of the published and unpublished information about smart recovery to get a sense of what the literature said about the benefits that people have. We know from talking to participants and facilitators that smart recovery is something that people find to be useful. It's something that they really engage well with. But when it comes to getting funding, when it comes to talking to people and trying to seek referrals into smart recovery, for example, people are asking for the data. People want the kind of hard evidence around the impacts that smart recovery has. And so that sort of led to this systematic review. What we found is that, yes, there's evidence to support the usefulness of smart recovery. We've got things like changes in behaviours, for example, reduction in number of drinks per drinking day or frequency of alcohol use, for example. But we also found that there was this real useful opportunity to be able to improve the evidence base. Back then, when we looked at all of the evidence, there was real lot of variation in how people define success. Oftentimes it was in terms of the behaviour itself. So for example, sobriety, abstinence, or perhaps a change in the behaviour. And although these things might be important and can be important, it's not the be all and end all when it comes to determining success. There's a lot of other really important things to keep in mind, quality of life, functioning, for example, and things like mental health. Evidence didn't have much to say around the impact on mental health. And so there was this real opportunity to be able to create something that would allow us to collect that information in a much more balanced, holistic kind of way, and also to extend the evidence base beyond alcohol. So that's the background to the research project that led to the development of Smart Track. So basically, we wanted to be able to develop something that would allow us to collect this information, so we've got information about the outcomes that people are achieving when they attend Smart Recovery. But more to the point, we wanted to be able to develop something that was going to be useful to the individual. We didn't want it to just be a data collection kind of tick a box activity. We wanted to have a resource that would hopefully be something that would be useful and meaningful to the individual. And so we thought about developing an app. A reason for wanting to do an app is that smartphones are everywhere. And that they've got that functional capability to be able to collect information and then feed it back in a meaningful kind of almost live kind of way. And so when it came to developing Smart Track, we did it across a couple of different stages. Stage one, keep on bumping my mouse, I might just pop that over there. Stage one was conducting a lot of qualitative interviews. So we did interviews with Smart Recovery participants, we did interviews with facilitators, because we really wanted to try and develop something that actually met the needs and preferences of the people who would ultimately be using the tool. So we asked things like the type of domains that people might want assessed, or the type of outcomes that would be useful to track, how they might want that feedback, and also the kind of look and feel and content of the tool. And what was really neat about GHO, and I'll give them another shout out now, is their flexibility in being able to develop the tool. So we were able to take our learnings from the evidence, we were able to take our learnings from our interviews with our participants and our facilitators and combine all of that into the actual making of the tool. So it was like build a little bit of Smart Track, get some feedback, change it, build a little bit more. So it was this really nice to and fro kind of process. And we're even able to have participants come into the offices at GHO, play around with some of the original prototypes and let us know what was working well, what was working less well. And then we could sort of change the look, the feel, the content to some degree based on that. So it was really exciting to be involved in this project where we've been able to have input from participants and facilitators from the very outset. So then once we developed something, once we had our Smart Track tool, then we did a feasibility study. So we basically wanted to see what we've come up with, is that something that people find to be useful? Is it something that they're going to use? And so I'll give a few of the findings from those in a moment. This is just a little bit of a summary of the key question content that is captured by SmartTrack. Hopefully it doesn't feel too overwhelming to kind of look at it like that, but I just wanted to show that, yes, we were able to meet our comprehensive, holistic aim of being able to develop a tool that captured information across a range of different domains. Because there is a lot of information that SmartTrack captures, we're also mindful we didn't want to send people a gazillion questions and then have them kind of put off by that. So when people do receive questions to be able to assess these domains, we've split them in a fortnightly cycle. So they'll receive some this week, some the week after, and that way you can still track all of that stuff, but in a little bit more of a user-friendly way. Little bit of background in terms of our selection of the items that SmartTrack actually includes. We tried to choose items that other services use as part of their routine outcome monitoring, and then that allows us to kind of have a bit of context or comparability in terms of the data that it's collecting. And then also it was really important that it was something that was familiar and consistent with Smart Recovery. So there's a 7-day plan and an interactive urge log that we've also included. And this one, I'm pointing at it, you can't see, the recovery one on the right-hand side of the screen, the substance use recovery evaluator, the domains in that one, this questionnaire was developed in really close collaboration with people with a range of problematic behaviours. Jo Neal in the UK sat down, a whole bunch of qualitative interviews with people. What does recovery mean to you? What domains does it include and how do we assess it? So again, we really wanted to try and make sure that the questions that are included in here meet those needs and preferences of the people who are going to be using it. And I'll show you in a moment live what these kind of things actually look like in the app. Became really clear when we were doing our qualitative interviews that although it was really important to be able to answer questions and get feedback, so that core outcome and feedback function of the SmartTrack, people wanted more. They wanted the app to be able to do other stuff too. And so that's why we've got a resources section, and that's why we extended the functionality of the 7-day plan and the interactive urge log. It's worthwhile also mentioning and also acknowledging that the lived experience stories that are included in the app, Carla Trelaw and a team of researchers from across Australia, they developed that resource as a part of qualitative interviews. So again, we're trying to incorporate research and evidence and stuff that hopefully reflects the actual lived experience of the person who will be using the app. Oh, didn't mean them to come up individually. So before we move on to the actual orientation to the tool and a bit of question and answer, I thought it would be useful just to provide just a couple of findings from the study that we did. We have actually submitted our findings for publication. We've got some feedback that we need to address, but hopefully the findings will be available in full online, maybe within the next couple of months, depending on when we respond to our feedback. But just a little snapshot here again, just to give you some context to the app. It was trialled with 72 people, mostly male, mostly experiencing difficulties with alcohol and a lot of past experience with mental health related stuff. So basically the people who ended up trialling the app are very similar to what we know about the majority of people who attend Smart Recovery. Good news being people did use SmartTrack. So we've got 94% of our participants who created an account, a fair proportion of those who went on to continue to use it at least once, and then almost 60% of our people went on to use SmartTrack for 5 or more weeks. Oftentimes it wasn't in like a 5-week block. People would kind of dip in and out as to how frequently they use the app. And we figure that that actually kind of fits with the way that people might use Smart Recovery rather. That oftentimes you might have like a core people who attend on a weekly basis, but then there's also a lot of people who are going to dip in and dip out. So it seemed like SmartTrack was kind of fitting with that dip in, dip out attendance. In terms of quality, we asked participants, we used a scale to assess the quality of it. And on this scale, 1 is inadequate, 5 is excellent. And so you can see from the scores there, we're getting high 3s to 4s, which means that we've got people being pretty okay, pretty satisfied with the quality and relevance of the information, the functionality of it, the fact that it was visually appealing, and also that it was engaging. And I think a big part of that is to do with the fact that we were able to get so much feedback from participants and facilitators throughout the development process. We also did interviews with participants after we had them use it for a while, and it was, for the most part, experienced as something that was friendly and user-friendly and engaging and useful. And what was neat about this is that we saw that experience even amongst people who might have described themselves as not particularly technologically savvy. So for example, Dougal, that's a pseudonym, even a village idiot like me could use it. And so we were really excited to find that even though at times people might have experienced some difficulties with it, it was something that was easy enough to overcome and overall was experienced as a user-friendly tool. And importantly, when we talked to facilitators, again, we got some really positive feedback that the SmartTrack app was experienced as something that was consistent to the program, something that could potentially support the program, and something that people could use in between sessions and or potentially facilitate content for discussion in group. Okay. So that's it in terms of the first little presentation side of things. I wanted to switch across now and just give a little bit of an overview of the app itself and take you through some of the key features. Before I do that, was there any questions that anyone wanted to pop into the question and answer section of anything that I've talked about so far? No? Okay, we're looking good. So let me now share the SmartTrack app. Okay, so I'm hoping that everyone can see the SmartTrack app. So here we have our home screen. So you'll see that at the top, we've got my 7-day plan is currently empty. This is the landing screen where if people haven't yet answered their questions, so the questions are the things that link back to all of those domains that I showed you before. If people haven't yet answered their questions, it'll let you know here on this landing screen. And importantly, there's a section down here where you can pop in your next meeting. One thing that's important is that the timing of the 7-day plan, the timing of the questions are going to be linked to the time that you've got here as your next meeting. So at the moment, I've got mine for whatever reason as Wednesday at 3:21. And that's why my questions are showing up as available. The questions show up the morning of your meeting. And we did that so that then people have an opportunity to reflect on their week before heading to a meeting. Of course, they can answer the questions without needing to go to a meeting. But when we were developing the SmartTrack app and based on feedback that we had from our participants, we wanted it to be something that kind of made sense within the context of meeting attendance. So that's why the questions will show up on the morning of your meeting. If you happen to change your meeting date, the questions will follow the change in the meeting date, but on a week-to-week basis. So you'll only ever have to answer questions once a week, but they will consistently show up on the morning of your meeting. With that in mind, it's also going to influence your 7-day plan. So it may show up here. So I'm going to show you, I want to create a plan. I need to add a task. Let's go for a run this afternoon. So today is, so it won't let me set, don't worry. Joys of live feedback. This is actually a point that I did want to make. See how my calendar is currently empty? That's because my meeting is due today. So in terms of the 7-day plan, it's going to open up next time after I go to a meeting. So after 3:21 this afternoon, once I've done my meeting, then I'll be able to start setting plans for the future. So keep in mind, planning and your questions are always going to be linked in time and place to your experience of your meeting date. So here's where you can do your plan. That's your home screen. You can also quickly access your resources from here as well. Before we do that, I'll give you a little bit of a taste of what the questions look like and how long it takes to be able to go through a week cycle of questions. So it asks us how many meetings I've gone to. And these are some of the questions from the SURE, the Substance Use Recovery Evaluator that I mentioned. So we've got some self-care questions. So this week, have I been taking care of my mental health? Have I been taking care of my physical health? Have I been eating a good diet? Whether I've slept well? If I've had a good daily routine? And then we get to main behaviour of concern. And with the main behaviour of concern, it asks us what substance I've used. And then based on whatever you've selected, it'll let you know, it'll ask you how many days you've used it. For alcohol and tobacco, it tracks number of standard drinks and number of cigarettes. So let's go 5. And then we also wanted to include questions that looked not just at alcohol and other drugs, and that's what these ones are for. So it comes from one of the very few screeners that are actually out there that look at non-alcohol and other drug-related behaviours. So it gets people to reflect on how frequently they've done a behaviour and it felt too much. So 0, not at all, 10 is too much. So let's say I've done gambling, 8 worth of too much. And then it also looks at shopping, sex, pornography, internet, food, video gaming. And if your behaviour isn't captured by those, it gives you the option for other. These ones are back to the SURE. I've drunk too much. I've used street drugs. Wording of street drugs might not necessarily fit with Australia, but it's based on a validated scale that was developed in consultation with participants in the UK, and that's why we've kept the wording the same. I've experienced cravings. How often I've felt like I've coped with things, whether I've managed pain and ill health, whether I've been spending time on things other than alcohol and other drugs with my hobbies. And I guess if there's very likely, and this is something that came up in the study, that participants might be struggling with something aside from alcohol and other drugs. These kind of questions, yes, they focus, the wording is on alcohol and other drugs. Again, it was developed for that population in the UK, but there's nothing to say that people can't use it in relation to their own behaviour. Then we've got some questions around relationships, resources and mindset. Have I been getting along with people? Have I felt supported? If I've been treated with respect and consideration, and if I've treated others with respect and consideration. These are the resources ones. So have I had stable housing? Do I have a regular income at the moment? And do I feel like I've been managing my money well? Then we get a quality of life question. So again, our reason for wanting to include all of these different domains is that they're so integral in terms of people's experience of recovery, that recovery, whatever it means to the individual, is an incredibly personal journey. And so we wanted to include things that allowed people to see a range of things, so we're more likely to actually capture what matters for them. This is more of a mindset thing as well. I've had realistic hopes and goals for myself. Okay, so that's me answering the questions. I'll come back and show you the feedback in the moment. It is fairly quick, but it does take a moment for the data to go to the cloud and come back. So if I went to the feedback right now, it might not be there. So bear with me, I'll let it do its thing in the background. So that's the question. So that's the longest set of questions. And then on the alternate week, people receive some questions around mental health and quality of life. So that's the longest that anyone's ever going to spend going through and answering those questions. I'll take you through the me section. So bottom right corner, that's the me section. And this is where people come to tailor the experience of the app. So they might pop in their reasons for change and their main behaviour of concern. Reason for doing that is just a bit of a reminder of what it is that people are working towards. When we did the participant interviews, people wanted a section where they could have all of their recovery contacts and services sort of in the same place. And that's what this contact and services is. So you can add a contact from your personal phone, or you can add a service. So we've got a list of services within the resources section, and a lot of those have a 24-hour number or online support. I've just noticed a couple of things come up in the chat, so bear with me for a sec. Awesome, it's being dealt with. So I'll come away from services. Now, this is one of my favourite features and one of the ones that did come out amongst participants as well. This is where you come in the app to be able to personalise your experience of the urge monitoring, which I'll take you through in a sec. So you can add a photo, personal photo, something that you want to see to be reminded of when you're experiencing an urge. So we'll add a photo, we'll select it from our gallery. This is just the beautiful sunrise that happened the other morning up this way. You can add a caption if you wish, and then you've got that there, and I'll show you what happens with those in a moment. You can also add video content should you wish, and you can add written content. So this might feel a bit trite, but you can do it. Okay, and I'll show you what happens with that in a moment. So yeah, this is where people come to personalise their experience. So now that I've popped all of that in there, if I happen to be experiencing an urge for whatever my behaviour may be, this is the button that I come to, the red urge button. It asks me to rate the intensity of my urge. And then when we come to this section, it actually shows me back some of that stuff that I've popped into my me section. And you have the option of going through, bringing up the motivations, getting through your urge, and then coming back and logging it. Or if you just kind of wanted to use the logging as an opportunity to manage your urge, you can do that too. So you can just hit log here, what prompted the urge, argument, it's a low one. How was I feeling? I was tired and I was frustrated. And was I happy with how I managed it? And this is part of the interactive feature as well. If I am happy with how I managed it, I can write it down. If I'm not happy with how I managed it, I can also write that down and then aim. So let's go, yes, I was happy. What did I do? Delay, distract, went for a walk. And if I want to add that as a motivation, I can. And then next time when I experience an urge, this will come up. And then the same thing happens if I wasn't happy with it. I can remind myself how to do things differently next time around. And so to get your feedback for your urges, down the bottom next to the other feedback one, next to the progress, you'll see the track urges. So to enter the information about an urge, you go to the urge button. To get feedback about the urges, you come down here to the track urges, and you'll see that here's a summary of my low, my medium, my high urges over time, the number of urges that I've had this week, average urge time, and then that written information that I popped in comes up here as a little bit of a summary. And this is one of the features that we were able to update based on that generous benefactor. that we've got much more feedback in here now and much more flexibility than what we had in our original version. So I'll bring you back to the home screen, and now we'll go to the progress. So progress screen, a couple of things about the progress screen. People need to have answered the questions in order to get feedback. If they're missing the questions or they're not answering the questions, unfortunately, they're not going to get feedback in here. So it's really important that we encourage people to be willing to give the questions a go so that then they can start to track their progress across time. You'll see that there's a lot of domains. We've got behaviour of concern, effective substance use, self-care, relationships, outlook on life, resources, and mental health. This is courtesy of us wanting to have a holistic thing. Not everyone is necessarily going to care about all of these things, but it gives us an opportunity to try and cover as many bases as we can. So if you're really interested in tracking your progress just based on your self-care, all good, you can always just come to the self-care button. There's 2 layers to feedback, because when we met with participants, some people felt really overwhelmed by detailed feedback. So they just wanted a snapshot. They just wanted to quickly be able to scan and then they're done, they're good. Other people felt disappointed by only having a really little amount of information, so they wanted to be able to click and get more information, and that's why we've got a couple of screens. So I've just seen a couple of other things coming up in the chat, so I'm just going to double check whether there's anything I need to attend to. All good. I think Michael's, thank you very much for dealing with extra questions that are happening. Okay, so we've got lots of different types of feedback. If you use this screen, if you're more of a snapshot kind of person, or if your participants are more of a snapshot kind of person, just encourage them to come here and have a bit of a look. You'll see that you've got the opportunity to be able to see how you're comparing to the last time that you answered the questions with these little buttons. So doing good, doing well, doing less good. Again, trying to borrow from information from motivational interviewing so that we've got kind of that similar sort of flavour to the feedback that we're giving. If you're a details person or you want some more feedback, then you click the button. So let's come back to the self-care. And you can see that I'm tracking my progress across time here with the graph. Green's when I'm doing good, orange is when I'm stayed stable, and then red is when I've perhaps taken a little bit of a slip or gone a little bit backwards. Again, we wanted to cater to different types of feedback that people liked. Some people loved graphs. They really thought that that was useful. Other people, not for them. And so that's why we've got both graphs at the top and then this little written section in the middle. The helpful advice, not so much advice, I guess, as statements or self-reflections. Again, we've borrowed very heavily from a lot of the motivational interviewing literature to encourage people to reflect on their feedback, to think about what's been going well, less well, how they might like to continue things and change things, perhaps take stuff to a group. And then as part of the interviews that we did, people wanted to be able to keep a journal and their responses to the feedback. And so there's that opportunity as well. So for each type of feedback, this is what we give. So just an example, let's go to mental health. It's saying it's not great, my mental health has gone down relative to the last time that I answered. And then my helpful advice is, how have you been looking after your mental health? Are there any other changes that you'd like to see? So it just gives people an opportunity to kind of reflect on the stuff that may have been going well or less well. So that is the feedback side of things. Again, we remind people that everyone's journey is unique, that the tracking side of things is encouraging people to have a bit of a think about how stuff is going for them. They may find it useful, they may find it less useful, and that's okay. It's very much up to the individual. And then our last feature on the SmartTrack app is our resources section. So as you may have seen on the slide before, it's a little bit of a mixture of lived experience stories as well as practical stuff. The useful readings come from the Smart Recovery tools and resources that are available online. And then our motivational stories come from that lived experience website. At the moment, the motivational stories are very heavily centred on alcohol and other substance use, and that was feedback that came back to us as part of our qualitative interviews. And that's something that, as far as I'm aware, Smart Recovery is working on being able to address coming into the future, that there will be more variety in the motivational stories that are available. It's just at the time of doing the study, the resource that we selected was based on interviews that were done with people who had experience with alcohol and other substances. And then here's the help and services. So this is just a list of Australian-based recovery resources. Again, we've tried to choose ones that have a 24-hour support that is potentially available. So I think that that's it in terms of the features side of things. So I'm just going to switch back to presentation. Bear with me. I thought I had my share feature nailed, but now I can't bring up the slide that I was actually looking for. So I think I've got about 2 more slides that I was hoping to go through. Is there any other questions that people wanted to ask based on the information that I've gone through so far? I'm just going to have a quick look in the chat feature. Do you have a user guide for practitioners to support their clients with? Yes, we're looking at being able to develop resources for facilitators and participants. That is on the agenda, and as far as I'm aware, should hopefully be coming out soon-ish. That's something that we're working on because, yes, we agree that it would be really handy to have something that would support the use of it within groups. Good old Zoom. One moment. Sorry, my computer's frozen. What I might do is just share it that way. There we go. So unfortunately, that's not full screen, but hopefully people can still, yes, not a problem at all. As far as I'm aware, the PowerPoint should be available. I think we should be able to send it to all attendees. And if not, as far as I'm aware, both the video and the PowerPoint is going to be available on the Smart Recovery website. So apologies for not full screen, but despite working on a technology project for a couple of years, unfortunately, my tech savvy at times fails me. But in terms of where does Smart Recovery fit, that's probably a really important and useful question to address now that we've gone through and given you a bit of sense of what Smart Recovery or Smart Track looks like. Basically, it's designed to be flexible. So it's a flexible tool, it's a flexible resource. When we talk to participants, when we talk to facilitators, and when we sort of thought about developing something like this, we thought that it could be something that would fit. I'm blinking, let's just check. Okay, amazing. Okay, so it's a flexible tool. It could potentially be used before the group. So we've, as I mentioned, we've set the questions in relation to the actual meeting date that people set in their tool. So we suspect that, and people did, is as part of the study, would use it before coming to a group to answer their questions. And then also people would use it after the group to be able to write down their 7-day plan. From a research and from a clinical perspective, writing something down, really important. And so we're really hoping that being able to have Smart Track used at the end of a group to formally document in people's 7-day plan is going to be a really useful thing. It's also likely to be used between the groups. So people can jot down their progress towards their 7-day plan. And unfortunately, because I don't have one in my app at the moment, I can't show it to you. But when you tick off a task, there's all of this celebratory confetti that happens in the app to congratulate you for meeting that task. We've also got the urge log that's used between sessions and the resources. And then it's also likely to be used, and again was used, during the group as part of perhaps the feedback session. So people sharing their learnings, their challenges, their successes. And that was something that came up when we did the qualitative interviews to begin with, is people said that sometimes they found that they would forget the successes because life happens, and they would end up talking about some of the less good stuff. So being able to have Smart Track as a bit of a reminder of perhaps when things were going well or some of those successes gave an opportunity to actually share that with the group as well. So in terms of our development process, we're really excited that this is something that was informed by end user expertise, best practice recommendations. It's something that we found to be feasible and acceptable, and that it gives us this opportunity to be able to not only collect really holistic information, but also help participants to be able to track that information across time. So we've managed to meet that aim of having that sort of building the evidence-based goal, but in a way that's personally meaningful to the individual. And it's a world first. This is the first time that this kind of routine outcome monitoring and feedback tool has been used within the context of a mutual support setting. So we're pretty excited. So that's all in terms of my content for today. So I'm just going to take a moment to take a quick squeeze at the chat feature and the question and answer feature, and just make sure that everything is being attended to. So bear with me while I scroll. Okay, so I'm going to start from the bottom and work my way up. So we have a question from Janaea about how the app will accommodate those that have low literacy, curious about how it works. Really important question, and that is definitely a limitation potentially of this particular version of the app. The questions do rely on some level of literacy to be able to answer them. Encouragingly, what we did find is that we did have a couple of participants in the study who did experience difficulties with literacy, and they had people like peers in their group who were willing to help them complete the questions, or there was another group that had the facilitator who would help the participant complete the question. So I appreciate that could potentially be a comfort thing or a privacy confidentiality thing, but for low literacy, it is doable, at least in a limited way at the moment. Depending on future funding, it would be amazing if we could improve it for low literacy. So thank you for asking that, and it's a really important one. So questions. So going backwards was not a good idea because people are coming in. So let me start from the top and go down. So I've got the links. I've got overseas questions. At the moment, in terms of availability overseas, the back-end data capture of the app is quite big. And so that and a couple of other logistical things means that at the moment it's only available in Australia. If we get more funding and we're able to tweak some things, improve some things in the back end, then that means that, yes, we would love to be able to extend beyond Australia. But at the moment, and especially since we're only just coming off a feasibility study, at the moment it's just available within Australia. And I'm very excited about everyone's excitement about this and wanting to see when and where it can be available. And so, yes, so Smart Track is free to, so the question is, can non-smart attenders access the app? Yes, they certainly can. It's free to access, fee-free to access on the app stores. And I think Michael has already attended to that one, so thank you. Different languages, that would be amazing. So there's a question there around whether or not the Smart Track app is available in different languages. And yes, we would love to be able to accommodate different cultural backgrounds. If we could make this something that was bigger and better and available worldwide, then that would be amazing. However, again, joys of research and joys of app development is that it would require additional funding. But yes, that would be brilliant. Are the clients anonymous? Okay, really good question. So when it comes to the Smart Track app, we've got a really clear, extensive privacy policy, because that was something that was incredibly important to people when we were talking to them in the interviews. Privacy, confidentiality, if not done well, massive barrier to actually using something like this. So we've got a really extensive privacy policy. We've got, which, I mean, it's not just the policy in and of itself, it's the actual stuff we've got in the policy. So when data is collected, so all of those questions that I answered, they can't be linked back to me. They're captured over here. And then anything that I enter that could potentially be personally identifiable, say, for example, my email address, that's captured over here. So you can't link that stuff to my data. And then the added thing anyway, if you were extra worried about being personally identifiable, the email address is really the only thing that's potentially personally identifiable. So if you had a concern about that, you could make up an email address and use that. Reason why an email address is needed is because of the whole password recovery thing. So the data in the back end is can't be linked back to individual people. Would you have a user guide? I think I answered that one before when I started at the bottom of the questions. Yes, we're aiming to be able to put that out. And yes, so without an appointment, say 7 days time, you can still use the app. If you aren't attending Smart Recovery, you do need to be able to pop in a date to be able to start that 7-day cycle rolling. So if you know that you've got free time on a Sunday evening, or perhaps that's a risk time for you and you want to be able to be spending time working on this, just pop in that date. So you just need a date or a time in that meeting date thing. And then that way your 7-day plan and your questions will always be linked in time and to a particular date. But yeah, you can still definitely use it without actually needing to attend a meeting. Amazing. Thank you very much for that resource, Fran. So Fran has provided a resource about the experience of problematic users of internet pornography, which could potentially be useful to include in the app. So we can pass that on to Smart Recovery. Yes, I can definitely send the PowerPoint to attendees. And then we've got another question around the privacy and confidentiality from Nadine. So Nadine, if you just wanted to put a bit of a comment in the chat function and let me know whether or not I addressed your concern around privacy and confidentiality. I think there's a bit of overlap to the question from earlier. But if there is anything else that people wanted to know about privacy or confidentiality, pop it into the chat feature and I'll address it. Cost, note we've got fee free. Sorry, I'm just still scrolling down. And then we've got the literacy question, which I've answered. Is there a plan to create a similar app just for friends and family? Again, I think that sounds like a really useful and interesting idea, and actually one that did come up in the literature, that it'd be amazing to have sort of a companion app for the Smart Friends program. So again, depending on funding, never say never. Okay, so we've got a question here from Matthew. Thank you, about being recommended as a support tool. That's exciting to know. Amazing. Okay, so then we've got what would you suggest from Sebastian? What would you suggest that we say to participants who may be wary of entering personal data into an app if they are concerned about privacy? Yeah, it's a really big one. And I think that this is probably where the resources side of things comes into it when we actually develop the manual, I guess, or resource for participants and facilitators, that this is definitely going to be a frequently asked question. And it would be useful for us to put a response or a way of being able to handle that as part of the resource. I think in brief, when I was working with participants, I would let them know that the only personally or only potentially personally identifiable thing that the app captures is your email address. If you're not comfy with that, make up an email address and use your email address for that. That information, your email address, is stored in a whole separate place to any data that you capture. So that data is just numbers that you've entered on the question. The research team, Smart Recovery, can't identify you from that. That was the main kind of summary that I would give people. And then definitely point them towards the privacy resource if they've got further questions and concerns. Retention period. Really good question. We've just recently had to answer that as part of our privacy policy and ethics. And for the life of me, it escapes. I can't remember if it's 5 years or 10 years. Sorry about that, Karen. If I will look it up and then I can include it as part of the resource pack that comes out arising from this webinar. Is that okay? I apologise for not being able to answer it right now without scooting around, but we do have very clear guidelines around the actual retention of the data. Okay, I know that I'm going through the chat feature, but I will come back to the question and answer. I haven't forgotten about the question and answer. Can I check if the app has a direct button or link? Okay, so push notifications. Push notifications come up as the Smart Recovery, the little pointing at the star, at the Smart Recovery star. So at the top of your phone screen, if you've done a 7-day plan, or your questions are available, or you've got an unlogged urge, you'll receive a notification at the top of your screen that will have the little star. We did that to be quite unobtrusive so that it feels secure. Now that you've mentioned, I can't remember whether or not you can turn off the notifications in it or not, but when people found out that that was the only bit that was going to be showing up, they felt pretty comfy in being able to have the app on their phone. Okay, so we've got the question and answer box. So we've got Ewan saying that they work on dual diagnosis, that the app looks good and would love to discuss further regarding the potential in an inpatient setting. Thank you very much for that, Ewan. We're more than happy to talk further about potential uses of the app, again, depending on funding. What measures are in place to ensure confidentiality? Thank you very much for that, Bob. Feel free to let me know whether or not there's other privacy and confidentiality questions that need to be addressed that I haven't yet. So we've got a question from Joyce asking if the app has a direct button or link to search my meeting, to bookmark and add the online Zoom link to the calendar. And I answered the push notification. Sorry, I answered that question in half. In terms of the find a meeting, that's something that I didn't demonstrate in the demonstration. It does take you to the Smart Recovery website. So at the moment, I guess that feature is possibly a little bit clunky, that it'll take you to the Smart Recovery website, and then you can search the Smart Recovery website for your meeting to get an idea of what ones are available. But at this stage, in terms of the functionality of being able to directly link and bookmark, that unfortunately is on the agenda for sort of future versions, depending on funding. Difference between using it in conjunction with a meeting as well as a standalone app. Thank you very much for that, Cameron, and apologies for not getting to that sooner. Thank you. So in terms of the similarities and differences between using it as a standalone versus in between meetings, when we developed the tool, we developed it as something that we saw as a companion to Smart Recovery meetings. So we expected people would potentially already be linked in with Smart Recovery or some other kind of support. And that then this was something that would allow them to track their progress in conjunction with that. That's not to say that it can't be used in between meetings or as a standalone resource. I guess we need to be careful in the way that we're thinking about it, is that it hasn't been developed as a treatment. So it's not something that we're expecting to be an intervention in and of itself. It's a self-management resource. It's a tool. It's a support. And at this stage from the data that we've got, it's something that's not harmful, which is also good. Not only is it feasible, it's acceptable. We also found that there was no harms associated with using it. So kind of talking around, I guess, in a bit of a circle, but similarities and differences is that if people were using it themselves without going to a Smart Recovery meeting, they basically just need to make sure that they're popping in some kind of date to let the app know when to send the 7-day questions, when to send the plan. And then it would be up to them to be able to use all of the other features as and when they see fit. So they can set their goals, they can work towards their goals, they can get their feedback, they can follow the resources to be able to get additional support. I'm not sure if that answers the question. Feel free to pop another question in there or reach out to me after the webinar. I'm more than happy to talk further as needed. Okay, so I think from looking at our question section and our notes section, I think for the most part, we've been able to go through people's questions. I'm mindful of the time. We do still have a few moments that are available. Thank you very much, Karen, and goodbye to other people who have needed to shoot through. Is there any other questions that, oh, yep, I've had a couple pop up in the QA. Do we know how many users already downloaded and used the app? Is it shareable? Amazing. Thank you, Joyce. We are collecting that information in the back end, but as of yet, we've not yet to sit down and look at that data. But that is something that we're aiming to be able to do throughout the year, to be able to get a sense of what's happened now that we've sort of officially launched it and how that compares to when we just did the study. But it's definitely an ongoing learning process, and we've got a wealth of information in the back end to be able to learn from. And Lisa, sorry, I think I skipped over your question before. Apologies for that. Can participants be seen on screen during meetings? I'm thinking that this is possibly to do with the online Smart Recovery meetings. Feel free to jump in if that's not actually correct. But in the Smart Recovery online meetings, as far as I'm aware, people are able to either turn their camera on or turn their camera off. It's up to the individual. In terms of the Smart Track app, there's no video or visual or anything like that that is linked back to the participant. And Lisa, your question actually reminded me something that I should have said previously. Those personal motivations that people pop into the app, their videos, their photos, that's for them. That never comes into the back-end data collection. We make sure that that all just stays local on the person's phone. Okay. Rightio, well, I think that is the end of the time that we do have available. I'm hoping that you can see it. My email address, I'm hoping that you can see it on the end of that slide there. If you've got other questions about the Smart Track app or about today's presentation, feel free to reach out. But otherwise, thank you so incredibly much for your willingness to attend today and all of the questions that you've put through. Really interesting to be able to hear people's perspectives and to be able to spend a little bit of time talking about, I guess, something that's been a really long time in the making. So thank you very much, everyone. I will leave you be. If I can work out how to be able to end the webinar. As I said, feel free to reach out, but thank you very much for your time.